When we talk about breathing, it helps to think of it as a pressure-driven process where air moves in and out of the lungs because the body changes the size of the chest cavity. And this change creates pressure differences that pull air in or push it out. And when we look at the volumes of air the lungs can hold, it gives us a clear picture of how much air we move during normal breathing and how much air is available when we need to breathe harder during activity. The main idea behind breathing is simple because air always moves from an area of higher pressure to an area of lower pressure, and the lungs follow the movement of the chest wall because they are attached to it through the pleural membranes. And when the chest expands, the lungs expand with it, which lowers the pressure inside the lungs and allow air to flow in. During inspiration, the diaphragm moves downward and the rib cage lifts slightly outward, and this increases the volume inside the chest cavity. And because the space becomes larger, the pressure inside the lungs drops below the pressure outside the body, so air flows in naturally without needing force, and this process is mostly quiet and effortless during normal breathing. Expiration during normal breathing happens mostly by relaxation because when the diaphragm moves back up and the ribs return to their resting position, the chest cavity becomes smaller again. And this reduction in volume increases pressure inside the lungs. And since the pressure becomes higher than the air pressure outside, the air flows out on its own. And this makes breathing out quiet and automatic when the body is at rest. The diaphragm is the main muscle of breathing, and its movement drives most of the air movement during quiet breathing. And the external intercostal muscle helps lift the ribs during inspiration, while the internal intercostal muscles and abdominal muscles help during forceful expiration when the body needs more air faster. And this teamwork between muscles allow the lungs to handle both gentle breathing and heavy breathing when needed. Lung compliance refers to how easily the lungs can stretch when the chest expands, and higher compliance means the lungs stretch more easily with less effort. And elasticity is the opposite idea. It reflects how well the lungs return to their original size after being stretched. And both of these properties help keep breathing smooth and efficient because they control the work needed to move air. Tidal volume is the amount of air you breathe in or out during one quiet, normal breath, and it is usually a moderate amount because the body does not need to fill the lungs completely in order to meet oxygen needs at rest. And this basic volume gives a simple starting point for understanding the other larger lung volumes. The inspiratory reserve volume is the extra air you can breathe in if you take a deep breath after a normal breath. And this extra capacity is useful when the body needs more oxygen, like during exercise, and the expiratory reserve volume is the extra air you can push out after breathing out normally, showing that the lungs always have room to adjust the size of breaths when needed. Residual volume is the air that stays in the lungs even after the strongest possible exhalation, and this remaining air keeps the lungs open and prevents them from collapsing. And because this air cannot be measured directly by simple breathing tests, it is often estimated, but it is still important because it maintains the structure of the lungs and keeps gas exchange steady. Total lung capacity is the maximum amount of air the lung can hold when they are completely filled, and it includes all the different volumes we talked about. And vital capacity is the amount of air you can move in and out when you take your deepest breath in and push your fullest breath out. And these two measures show how much lungs can expand and how much usable air the body has during heavy breathing.